Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi, my name is Ernest. I'm the owner and director of Natural Alternatives here in Monaga, Minnesota. We have multiple clinic states down in the Twin Cities, multiple clinics in different parts of the state, and also in Fargo-Moorhead. And so we have an opportunity to serve a pretty broad area through the state of Minnesota. And along with my associates, Dr. Mark Wheaton, Dr. Dave Gottenborg, and Dr. David Andrus, we are also bringing in a naturopath into our clinic here in Monaga. We are all collaborating, working together to help solve issues and give people alternatives that maybe they might not find in a normal mainstream medical facility. But today, as a little part of a very brief training overview, we're going to talk about a disease or an issue that we see happen quite often with young people involving the knee or the area of the knee, and it's called Osgood-Schlatt Disease. So in a real simple overview, these are just research papers that I found from off of Mayo, really good information that you can find out on the web about this particular disease or issue. And here was another one from the American Academy of Orthopedic Surgeons. Extremely good information out there about Osgood-Schlatt. And there are sometimes where even surgical intervention, corticosteroid injections, other things are necessary when they get to be really acute. But in simple layman's terms, what we see happen quite often is that young kids will suffer with Osgood-Schlatt, which is a growth or a irritation, inflammation, as you can see even from the information that's available on the web, an inflammation or irritation of the tendinofascial attachment of the quadriceps. So this long muscle that comes down and attaches at the bone here just below the knee or below the patella. And the kids will experience this, or young people will experience this as they're growing, where the diaphysis or the growth plate of the leg bone will actually grow faster than what the muscle can stretch to accommodate. And it just starts irritating this attachment, constantly creating gross inflammation. So right now I have an electromyopulse working on her, and it's treating using straight negative ion therapy. So when we treat this in our clinic, I'm putting an electropad over here and going up into her hip, treating the entire full length of the quadricep. And I'm also going to be doing a microcurrent with a probe, because a lot of times we'll find that this chronic irritation is being created by the attachments or the muscles in the quadricep that are just above the kneecap. And so very common that if I can get in here and start addressing these irritated muscle fibers that are in the quadricep, both the medial, lateral, and anterior attachments. And here in this case, she's got a really bad attachment right out here on the lateral side of the quad. So she's getting this torque, this pulling here, that'll eventually just create chronic inflammation and irritation. So when they're growing and they're going through this growth spurt really quickly, this is an area of the body that will be affected and irritated. And of course, because it's at the growth plate down here below the kneecap, there's also already inflammation and irritation there coming from the growth factors. I have seen sometimes that appropriate nutritional therapy or consult with your doctor or chiropractors, naturopath people can also help, because appropriate nutrition is also an important part of this. But interestingly enough, we also see an Osgood-like Schlatt type symptom happen to people who are older when they fall. A lot of times, especially this time of the year, they're falling on the ice and they impact serious pressure into either the patella or the shin bone, and this will be the site that will get irritated or inflamed as a result of the fall. And so they'll develop almost like an Osgood-Schlatt type disease structure that we see with young people. And I've seen it coming in here with an older person in their 60s, where they're suffering with this chronic knee pain as a result of a fall or an impact. Maybe they went down a set of steps or injured themselves in any way, shape, or form. So again, our goal here is using microcurrent therapy, and in this case I'm using straight negative ion stimulation here to help break down the scar tissue and also to get rid of the inflammation out of this attachment. Treat this 2-3 times, typically speaking, they heal up beautifully. And again, so I'm a big advocate for the possibility of nutritional supports, but those are things you need to consult with your physician over. One other thing is that when we see this irritation happen, and again, this is a tendinofascial attachment, so the quadricep has a long tendon that comes over the top of the bone and attaches into the lower leg bone. sometimes there's the tendofascial attachment will get so weak or so irritated that it needs to be proliferated. An associate on staff, Dr. Mark Wheaton, does that. He does prolotherapy to help reconstruct these damaged attachments. So again, another non-surgical option, which is part of the whole vision of Natural Alternatives, is to help people look at alternative ways to treat pain and dysfunction. We collaborate together. So check us out on the web at naturalalternatives.com. You can also call our clinic here in Monaga at 218-564-4200, and of course all the other clinic sites that we have throughout the state of Minnesota and into Fargo-Moorhead area. So again, thank you for watching what little bit we had to show here today. Get out on the web, do some research, but look at our clinic as an alternative option if you're suffering and struggling. Thank you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.